Many men believe that all treatments for erectile difficulties work in the same way. It often feels like a simple choice, especially when someone is seeking help for the first time. What is less known is that the body can respond differently to medications with different durations and dosing patterns, and that individual health conditions play an important role in how each option works. That's why many men don't realize the right choice often depends on their own body, daily routine, and overall health. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll explain how Tadalafil and Sildenafil differ inside the body, and how doctors consider individual factors when determining which option may be more appropriate for a particular person. Both Tadalafil and Sildenafil belong to the same class of medications known as PD-5 inhibitors. During arousal, blood vessels in the penis normally relax to allow increased blood flow. An enzyme called PD-5 can interfere with this process. Both medications work by blocking this enzyme, allowing blood vessels to remain relaxed longer and supporting the body's natural response to arousal. The key difference between these medications is not how they block the enzyme, but how long they remain active in the body and how quickly they begin to work. Because the body processes these medications at different rates, their timing and duration can feel very different from one man to another, depending on metabolism, overall health, and individual response. Sildenafil typically remains active in the body for about 4 to 6 hours. Tadalafil, on the other hand, can remain active for up to 36 hours. This difference occurs because the body breaks down Tadalafil much more slowly than Sildenafil. For men who value spontaneity over a longer period, Tadalafil may offer more flexibility. For men who prefer a shorter and more predictable window, Sildenafil may feel more controlled. It's important to understand that this difference is not about strength. With both medications, the body still needs natural arousal for the effect to occur. Another important difference involves how quickly the medications begin to work. Sildenafil is often associated with a faster onset, typically starting to work within 30 to 60 minutes when taken on an empty stomach. Tadalafil may take slightly longer to begin working, often within 1 to 2 hours. Although this varies from person to person, food can also influence how these medications are absorbed. High-fat meals may delay the absorption of Sildenafil more noticeably than Tadalafil. Because Tadalafil's absorption is less affected by food, some men find it more consistent when intimate moments occur around meals. There are also differences in how these medications are commonly taken. Sildenafil is most often used on demand, meaning it's taken when sexual activity is anticipated. Tadalafil can also be taken on demand, but it has an additional low-dose daily option. Daily Tadalafil is typically prescribed at doses such as 2.5 or 5 milligrams, which maintains a steady level of the medication in the body. This approach may appeal to men who value spontaneity without planning, or to men who experience urinary symptoms related to an enlarged prostate, as Tadalafil is also used to support urinary function. The body adapts differently to having a consistent level of medication compared to intermittent higher doses. Some men prefer the routine of daily medication, while others prefer taking it only when needed. Both Tadalafil and Sildenafil can cause similar side effects, including headache, flushing, nasal congestion, or indigestion. These effects occur because PD-5 is present in other parts of the body, not just the penis. Sildenafil is more commonly associated with temporary visual changes, such as a blue tint to vision, because it can affect an enzyme in the eyes slightly more than Tadalafil. Tadalafil's longer duration means that if side effects occur, they may last longer. However, with daily low-dose Tadalafil, side effects often become less noticeable over time as the body adjusts. Individual health factors are an important part of choosing between these medications. A man's age, cardiovascular health, liver and kidney function, and other medications all influence how his body processes these drugs. For example, men with mild liver or kidney impairment may process Tadalafil more slowly, which could extend its effects further. In these cases, doctors may adjust the dose or recommend Sildenafil instead. Men with diabetes may also respond differently to medication timing, because diabetes can affect blood vessel function in ways that influence how quickly the body responds. Lifestyle factors matter as well. A man who values flexibility over an entire weekend may prefer Tadalafil's longer duration. A man who prefers knowing exactly when the medication will start working and when it will wear off may prefer Sildenafil's shorter window. There is no universally better option. The appropriate choice depends on how a man's body works, what his daily routine looks like, and what his personal preferences are regarding timing and spontaneity. These differences do not mean that one medication is stronger or more effective than the other. Many men try both options at different stages of life to see which fits their needs best. Understanding how these medications differ is often the first step in having a more informed conversation with a doctor. Every man's body is different. Symptoms and changes can have multiple causes. This video is educational and does not replace medical evaluation. If symptoms persist, speaking with a qualified doctor is always the safest step. Now I'd like to ask you a question. Have you noticed differences in how your body responds to timing or duration with these medications? If you feel comfortable, you can share your experience in the comments. If this video was helpful, consider subscribing. In the next video, I'll explain how lifestyle factors such as exercise, sleep, and stress can influence treatment outcomes for erectile function. Understanding your body is an important part of taking care of your health.